This session is titled Community Safety Realized, Justice and Equity on the Pathway to Preventing Violence. And we are going to be hearing from our presenter today, Lisa Fujia Parks. Lisa is with Prevention Institute. And Lisa, I'm actually going to stop sharing my slides so you can get your slides up and introduce yourself. So here we go. You should be able to share your slides now, Lisa.
Wonderful. Wow, this is so incredible. There's 330 of us gathered here in this Zoom conference room, and I'm so incredibly honored. This just is, it was just so meaningful to me to get invited to be a part of this and to share with you. And I'm just really grateful that you've chosen to spend this next hour and a half with me. So I will go ahead and share my screen, and I'm going to do everything super mindfully and patiently. Let's see if I can get to where I'm trying to go. Here we go. So we want to present. Great. And oh, actually, you know what? I should thankfully, I have two screens going on, so I'm also going to be playing music. And yeah, so just want to express my gratitude and appreciation for your grace as I sit here in Oakland, California, Ohlone Lands, and manage screen, music, chat, notes, connection, presence, all of those things. So off we go. Many of you shared your name and your organization and the location that you are Zooming from. If you haven't, or if you want to do that again, please feel free to go ahead and do that. I also invite you, if you would like, to visit this website that we can put into the chat. That allows you to identify the name of the indigenous lands where you are located. So here's my first challenge, is to type that in to the chat. And as I mentioned,
Lisa, I can handle that for you.
Okay, thank you. I'm here in Oakland, California, which are the lands of the Ohlone people. And while you're doing that, or after you've done that, I invite you to share a recent book, movie, podcast, or other resource that has supported you and your understanding and action on intersectional racial gender justice and other forms of equity and justice. You will bring, so much richness to the conversation, personal experience, your own learning. There are so many wonderful resources and conversations that are happening right now. So I thought it would be inspiring to share some of those, many places where we can learn from. And as you do that, I'm gonna play a song if I can manage it. So let's see. And this is one of my favorites this year. It's called Warrior by Ray Zaragoza. Oh, wait, I think I have to share sound. Oh, can you hear that? I'm going to do a sound check. Were you able to hear that?
We can hear it, Lisa, yes.
Okay, and it was the quality was okay? Okay, I will continue. Spent my summer in the van. All right. Well, the chat messages are coming in. I just scrolled across, noticed that that you can't hear the lyrics. So I think I probably didn't share properly. I'm going to try to correct that because we're going to be having, yeah, here we go, share sound. Yeah, cool. So let me reshare again. Back to the screen. Okay, and I would love to check in with Ashley and Mo and Go team. There's so many people who are helping to make this happen. Thank you so much. I would love to hear some of what's coming up in the chat. I was able to look at some of it, but would love to see or hear from you. What's jumping out for you?
Lisa, there's so much in the chat. I have been trying to kind of keep up with like what people are sharing about what they're reading, and I just have a little list here of notes I've taken, but now I want to see the whole transcript. Some folks are talking about the Book of Lost Friends, United States versus Billie Holiday, Their Plant Eyes, A Personal and Cultural History of Blindness, the book Beyond Survival, the book How We Fight for Our Lives, and then the Combahee River Collective Statement. Those are just some things that I noticed, and there's still more messages coming in.
Awesome. So good. We're already kind of learning together and sharing resources, and I'm really looking forward to seeing what you all have shared. And please keep on sharing because, like I said, you all have, I have my experiences and what I'm prepared to share today, and it'll be so much more rich if you all share too. And then, we can compile and share back out. And I think I saw some mentions of resources where folks have compiled previous webinar and other kinds of resources together. So yay for sharing and learning together. So what are we going to do? Okay, today we're going to move through three distinct objectives, and the agenda is going to flow in this way. I'm going to share about a framework for community safety that addresses the structural roots of violence and involves community, relationship, and individual transformation. And probably those ideas are familiar to you being part of this work. So I'm grateful to have the opportunity to share a couple of frameworks that I've been working with. We're going to embed examples throughout the conversation, and hopefully, have that be inspiring and feel concrete for you. We're also I'm going to share a Google form where periodically throughout the next hour, we're going to take a pause, and I'm going to invite you to share your thoughts about questions to make these concepts concrete and applicable to your work. And the last part is practice around identifying choice points, which is a concept that comes from, or I learned about it through an organization called Race Forward. And it's a really practical way to take all these big ideas and need for transformation and kind of sort through it and bring it home to what is a choice point for me, for my team. So we're going to bring it down to that level of, hopefully you all leaving here with some ideas about actions that you can take. So I hope that, again, I can share things that are helpful for you and that we can make it concrete and practical as well. You know what? I just realized, well, I'll leave it on this slide, but I just realized I forgot to say a little bit about myself. And I did want to just tell you a little bit about myself to give you some context for what I'm about to share. So my name is Lisa Fujia Parks. I use she, her pronouns. I mentioned I'm here in Oakland, California with my family in Ohlone lands. I've been here for the last, 20 years or more. I grew up part of my childhood in Japan and in upstate New York. I'm multiracial, Japanese and white. I'm queer. I, like so many folks in this movement and in the world, am a survivor of multiple forms of sexual violence. I started doing campus-based work, and just shout out to my fellow students that just got me activated into this work. I actually started out doing work in the nonprofit community development field, and I then shifted to doing sexual and domestic violence work. I worked at San Francisco Women Against Rape, which was just an incredible growth experience. You know, it's like so deeply in my heart, the folks and the work from that time. I also worked at an LGBTQ plus organization called Communities United Against Violence, also just so foundational to who I am and how I am here today. Then I moved into public health work, and I work at Prevention Institute now. And my work really is to, you know, I facilitate, I coach, I advocate, and I work with a lot of communities across the country, really to do this work of fostering safety and healing, and really bringing that intersectional lens, equity and justice lens, and really being a, you know, firm believer in the power of community to organize and to build collective power, to put pressure on systems, to make them more accountable to communities, so that we have more justice and equity in the world. And there's a lot of work to do in that regard. And I'm just really honored to be a part of it and to learn with you today. So yeah, I think I'll leave it at that. Hopefully that gives you a little bit of an idea of who I am and where I'm coming from. And I just really want to show up in this conversation with a lot of gratitude, humility. And to start that off, or to continue that, here are just a few of my colleagues who helped to develop this content. I'm going to be drawing on the thinking and creativity and efforts of a lot of different people, even folks who are not shown here on the screen. So I may be sharing it, but it's certainly not all my work. I also want to give a huge shout out to Dr. Jamila Porter. She was going to present with me. She was actually working at an organization called Big Cities Health Coalition, who co-developed this Community Safety Realized paper with Prevention Institute. She got a new job, senior advisor for program and strategy at the de Beaumont Foundation. Yay for her. Yay, Dr. Porter. So that made it such that she was no longer able to present with me, but her work, her heart, her thinking is definitely embedded in all of these concepts as well. So shout out to Dr. Porter. Here are a couple of the papers, you know, and it's kind of weird to put up a paper, but you know, the paper includes words, ideas that come from people, communities. So here are titles of papers, but you know, they represent a lot of different people's work. Community Safety Realized, a health equity approach to preventing sexual violence that we co-developed with the National Sexual Violence Resource Center. So I think Jen's on today, so shout out to Jen Grove and NSVRC for that. Our Building Bridges paper, which is really about our work to build a stronger connection between health equity work, or public health equity work, and racial justice work. And I'm going to be sharing examples that are spotlighted in the publication A Health Equity Approach to Sexual Violence, up to Preventing Sexual Violence. And so here's just a quick presentation of the people and or the organizations and their websites that are highlighted there. But I'll talk more about these examples as we move through the conversation today. Two more pieces of gratitude. I mentioned Race Forward, so the concept of choice points, and also another concept that I'm going to share on equity objectives comes from this document, Community-Driven Climate Resilience Planning. So shout out to the National Association of Climate Resilience planners as well. I want to give credit to where credit's due. So we are still on giving gratitudes. I want to give gratitudes to someone who I deeply admire, Lila June, who is an Indigenous environmental scientist, community organizer, and musician of multiple Indigenous and European lineages. She's quoted in the NSVRC paper. Rape is fundamental to the problems we see in the world. I would put it as the highest priority for us to address, because this is where the root of life breaks down and is passed on intergenerationally. Really appreciate how much work she's doing to speak up about the connections between multiple forms of sexual violence and many of the other challenges that we are experiencing in the world. An amazing leader. So with all of that said, I want to take a pause and invite you to give honor and gratitude. Who do you give honor and gratitude to? We come here with so many people at our backs, at our sides, leading us, those connections, that sense of collective power is really important. So please go ahead and in the chat, let's take a moment to give honor and gratitude. And I'm gonna be quiet while you do that. So thank you so much for, naming those people and giving acknowledgement to them in the form of a chat. So typing their names and words, and thank you so much for sharing their names. If we were together and had more time, I would want to speak all of their names. So please do take the time to scroll through the chat and just lay your eyes on all these wonderful people who are being named. And please feel free to continue honoring and giving gratitude. Okay, so now I'm going to start talking about a little bit more sort of concepts and frameworks. I want to start with intersectionality. Probably and hopefully all of you are familiar with Dr. Kimberly Crenshaw. She has been talking about, writing about, advocating around intersectionality for many years now. And this is a quick definition that intersectionality is the study of how power structures interact across multiple identities, and it is the practice of transforming those power structures. And a quote from Movement Strategy Center that really reflects this is that our issues and problems are interconnected, and our systemic solutions and movements must be as well. So this is definitely a foundational concept that we're working with here. And there's so many dimensions to intersectionality. I won't be able to do justice to it all. But you all bring your lenses, your experiences, your communities. So as we continue, please continue to bring those forward. So speaking of which, another chat question for you. We're really looking at realizing community safety through equity and justice. And in doing so, addressing the fact that sexual violence exists at all, addressing the fact that inequities exist and who is forced to live with the burden of sexual violence and the threat of sexual violence, there are racial inequities, gender inequities, other forms of inequities. So I want to just invite you to take a minute to think about your communities that you're working with, that you belong to, that you are serving, and what are some of the inequities and realities that you are paying attention to and trying to transform, because that'll help give some specificity to how you think about things throughout the rest of this time. Again, I'm not going to be able to cover all of the complexities, all of the diversity, all of the issues, but I invite you to bring some specificity in what you are focused on and going to be thinking about throughout our time together, and also to reflect on, why do these inequities exist? We're going to talk about that in just a second, but I know that you all have lots of ideas and knowledge and expertise in this area. So invite you to think about that and share your reflections. So I've asked you a lot of chat questions, which I'm going to keep doing. And at some point we're going to move to the Google form, but I want to, again, request from my colleagues, Ashley and Mo. I know I'm asking you to do something impossible because there's a lot happening in the chat with 373 people. But if you could just bring some of the responses and ideas and voices into the room, I would be incredibly grateful. And it can be about this current question or some of the previous questions that I've asked as well.
Sure, Lisa. Well, I'll start by saying, some things that I'm seeing right now are really speaking to some of the inequities in the movement to end sexual violence and in our own organizations. And so, what kind of resources exist? Who's being represented? Who's not being represented? Those are some things that I'm seeing. What areas are people, so someone pointed out rural areas. There's someone that is under the name Friendship of Women Incorporated said a long history of colonization.
Absolutely.
Another one about rural areas. Yeah, Mo, are there things that are coming up for you that you're seeing?
Yeah, I'm seeing a lot of things about how different identities that folks have make it, I shouldn't say this, because I think what folks are saying is that our services that we have are not equipped to meet the needs of everybody. And a lot of those things are based in white supremacy culture is a thing that I'm seeing come up. I'm seeing that a lot of like cultural beliefs and taboos, the idea of machismo, certain things like that are coming up and creating more inequities. Different things in the media, I think, like stereotypes and the ways that media covers this topic is something that I'm seeing come up as well. Power imbalances, economic challenges. It's just really clear that people are really giving a lot of examples that are all really interconnected, right? The carceral mindset, disconnect between laws and policies and what communities actually need. All sorts of things. It's a little overwhelming looking at the chat, but these are really, really great things that folks are putting out.
Yes, thank you so much, Ashley and Mo, and thank you everyone. Yes, I'm really connecting with and identifying with and appreciating what you are sharing. And like I said, there's so much rich knowledge and experience. So as I move into sharing more concepts and frameworks, I hope that they might give you a language or a way to think about things that brings a new spin or a different spin, or just something to put in your pocket that you can pull out in different settings that hopefully will add value to what you already know. So let's keep going in that spirit. So one of the things that we did in writing Community Safety Realized, which I will give a very honest caveat that that paper really focuses primarily on and was written to focus primarily on community violence, meaning violence that's happening in community settings that is not of a sexual or intimate partner nature. So violence that might occur between people who may or may not know each other, but the component of it being a form of sexual violence or intimate partner violence was not the center of this paper. We did our best to integrate a racial and gender justice, multiple forms of violence perspective as much as we could. And the health equity paper with NSVRC is going to really help with that in this presentation today. And I really would love to hear from you what resonates and what doesn't, and what feels like it's missing, so that these things can be useful moving forward. But one of the things that we did do, which I was excited about, is to say there are 4 defining features of a public health approach. And these are going to hopefully look different than some of what you might have heard in other publications, other contexts of what a public health approach is really about. I'm not going to go into that, but there are many models of a public health approach that are very different from this. And we really wanted to do an update that reflected our best understanding of truly what is needed in a definitive way to advance a public health approach. So these are the 4 here that you see here, and I'll talk about each of them and share an example. So the first is truth, healing, and transformation. And that is about naming and building shared understanding that violence is rooted in structural racism, colonization, other forms of oppression. Naming that, really having a deep understanding of that these are the tap roots, the biggest source of where these things come from. And the importance of doing that work, because doing that builds the understanding and the collective will to say, then we need to change policies and systems at that level to make them more equitable, to address some of the issues that you were mentioning, the inequities in distribution of resources between urban and rural, between different communities, the inequity that exists in the movement to address sexual violence, and so on. So truth telling, building shared understanding, and building collective will to transform these inequitable oppressive roots, number 1. And I want to give an example of that and a huge shout out to the Black Women's Blueprint. And I apologize if I mispronounce this person's name and any name today, Farah Tanis, who was our contact in the write-up in the National Sexual Violence NSVRC publication. So just a little bit about their work. So Black Women's Blueprint is a Black feminist organization that works at the grassroots and institutional levels to address gender-based violence against women and girls in Black, African American, and other communities of color. They launched their Black Women's Truth and Reconciliation Commission together with survivors of gender-based violence, and they create models and systems of accountability and safety that reconcile survivors with their communities. So by creating cultures of gender equity and accountability, they're changing norms, and they have a truth and reconciliation community that works, for example, in churches, and does some of this work of truth telling and healing in a very culturally rooted context. Another setting is barbershops. And so they are really representing this concept, this principle of truth, healing, and transformation. And down at the bottom here, we're giving a shout out to CDC's technical package strategies. You'll see that in the publication, Health Equity Approach to Preventing Sexual Violence. We want to make connections that, these different frameworks and publications may categorize things slightly differently, but there's so much overlap in what's being said and distinctions. But here are some of the connections to those the Stop SV technical package. All right, moving on to community leadership and power. This felt really important to emphasize. This is really about that communities have people who are impacted by an injustice, a form of violence, really have the right to have leadership and participation and decision-making power on what should be done about this issue. And there's such a beautiful commitment to survivor leadership in this movement and leadership from communities impacted by racial injustice and other forms of injustice. So this really talks about how important it is to for community leadership and power, and to actively remove the barriers that we know exist to participation, including lack of willingness to share power and decision making. So one example of that, I want to give a shout out to Strong Oak Lefebvre and their work at Visioning Bear Circle Intertribal Coalition. They are doing prevention, education, and training and technical assistance work on interpersonal violence in tribal, intertribal, and multicultural communities. Their work is rooted in Indigenous values and practices of walking in balance with all our relations and protecting Mother Earth. And again, there's connections to technical package strategies, but I thought their work, again, shout out, and deep gratitude for your work that's really bringing important community leadership and power and voice to many communities and to the movement as a whole. Moving then to the third defining feature, data and evidence driven. And there's some nuance here in what we mean by that. Sometimes in my experience, the data that we look at or the evidence that we look at can be narrow. And we know that what's considered evidence or valid evidence is also weakened by the biases that exist within science, within decisions that have been made about what's considered valid or not valid, and who gets to decide, and whose research is supported, and that type of thing. So this is really about considering the full evidence base. So looking at the existing research, but also really valuing community leadership and voice as evidence, cultural context as evidence, experience doing the work or living through the issues as evidence, right? And examining quantitative data, but also looking at things like past policies, historic events, lived experiences, qualitative data. These are all part of the data, the truth, the stories that we need to look at to be informed by and to shape our work. And an example I want to highlight here, and I want to give great shout outs and appreciations to the Indiana Coalition Against Domestic Violence and Sierra Olivia Thomas Williams and the work they did in the city of Bloomington with the Bloomington Inclusion Collaborative, where they partnered with people with developmental and cognitive disabilities and local government, public-private agencies, and community service organizations on a participatory social mapping and photo voice and geographic information systems project to gather data and evidence about how community environments were having differential impacts on risk for violence against people with disabilities. So this is just a wonderful example of being data informed and doing it in such a way that really brings voice from people who are directly impacted by exclusion from really basic things, including access to safe sidewalks and the ability to have transportation methods. So just wanted to give that example of what we mean by data and evidence driven. So thank you for that work and for allowing me to lift it up through the publication with NSBRC and in this conference. All right, one more defining feature and example, and then we're gonna pause to get some more feedback. So the last, or the fourth, is collaborative action, and this is about shared leadership and decision-making power and sharing resources among community members, young organizers, political leaders, business owners, people who represent many different types of organizations and government agencies. Actually, the Indiana Coalition's work was a great example of that as well. And I want to elevate One Fair Wage's work. Some of you might be familiar with this campaign. It's also highlighted in the Health Equity Approach publication. And I want to give gratitude to Saru Jayaraman, who shared with us their work that's featured in that publication. And this really is about bringing together movements for economic, racial, and gender justice to advocate for workers in the restaurant and service industries, and to really address many different sort of workplace and wage inequity issues. And specifically, I want to lift up their work on elevating the connection between tipped wages, so people who are dependent on tips for their salary or for their wages, and the link between that, that's very evident that leaves people vulnerable to sexual harassment, abuse, and assault by customers. So they are working to eliminate tipped wages and to make sure that people have access to a living wage that is not dependent on tipping. And they're bringing together multiple movements, including folks in the sexual violence prevention movement and many other movements together to work at the local level, the state level, and the national level. So shout out to them as an example of collaborative action. So I want to pause there, and let's see what's coming up in the chat, and I will go ahead and do that. I'm going to scroll from bottom up, so I'm seeing, I love this, so thank you for that positive message. So I'm seeing, affirmation of the importance of talking about roots of violence. If I can lean on my dear colleagues, Ashley and Mo, once more, I think that probably will be the best way to lift up other comments that are coming up in the chat. So may I ask for some reflection back, Ashley or Mo?
Sure, Lisa. Sorry, I've been busy. I've been trying to post links to all of the amazing shout outs that you're giving and resources. I think I saw a comment about, we really need to be thinking about how do we change policy so we can, really get to the justice that we all seek and deserve.
Yeah.
I thought that was a really important comment. Mo, have you seen anything else that you wanted to highlight come up?
Yeah, absolutely. Phoebe made a comment about how when we talk about roots of violence and of racial inequities, economic empowerment absolutely has to be part of the conversation, which is such a good point. And I posted a thing about another workshop that's in this prevention track about equitable wages within our organizations. So check out your schedules for that.
Great. Thank you so much. Really appreciate your voices and that kind of moment of connection. It's really supportive. And thank you all for the chatting that you're doing. Yeah, I appreciate the comment about policy change. And, you know, and I think there was a comment about how kind of our current funded strategies really aren't addressing some of these issues or meeting the needs of a lot of different communities. So there's real transformation work that needs to happen, right? Like, we appreciate where we are and how far we've come and the resources and the strategies that are available. And at the same time, we need to just be constantly pushing that envelope and being as courageous and powerful as we possibly can to lean into deeper transformation, the kinds of work, including policy change, that we know also needs to happen. So we'll continue to explore what that can look like. And again, by the end of this, I'm going to invite you to think about your own choice points. You know, life is just a series of choice points where we can either do what we normally do and get the results that we normally get, or really try to pivot in small, repetitive ways that can really shift the direction of our work toward greater equity and justice. So thanks for reflecting, and we're going to keep moving. So the next part of the Community Safety Realized framework is what we call the pathways to violence or to safety. And it's another tool. Hopefully it'll be a useful resource for you. There are limitations to it, and I invite your reflection on what you see missing, what would make it stronger. But this is another piece of the Community Safety Realized framework that I'm going to kind of walk through fairly quickly. So the notion of a pathway that can really help to do some of that truth telling of why do we see sexual violence? Why do we see inequities in rates of sexual violence? So we're going to start on the left-hand side of the slide in social, racial, and other forms of inequity. So again, we're saying that what we see in the world today, the problems, the violence, so much of it is rooted in the legacies of structural racism and colonization and sexism and misogyny and patriarchy and other forms of inequities that come from the country's founding through today, right? So there's a thread from then to now that must be acknowledged. And when we have those legacies, when those inequities are built into the very foundation of the country, what manifests then is inequitable systems and institutions, like histories of redlining and inequitable government investment in racially segregated neighborhoods. And this refers to the practices of government and banks and other institutions where discrimination was baked into laws, unwillingness to give loans for housing or businesses was baked into laws and practices, or giving loans or grants to some and not to others based on race, denying access to communities of color, immigrants, laws and norms that have restricted women's and other people's, LGBTQ, people with disabilities, and so on, economic rights, reproductive rights, and other rights and opportunities. And again, here's where I'm not doing justice to the complexity of intersectionality, because I want to kind of move through this in the time that we have. But please bring those perspectives, that specificity, that complexity to your thinking and to your work. And I will continue to do that in my work as well. So here's what I'm just wanting to lift up right now. So we have these inequitable systems and institutions that have these practices, these decisions, and that creates inequitable community conditions where we see risk factors for community violence and sexual violence and other forms of violence, like terms like concentrated disadvantage or underfunded schools. These are all terms that are, it's like, oh, it's not quite exactly what we mean, but these are some of the terms that are used in the discourse, in the literature, and so on. Discrimination in workplaces, community norms that tolerate or even promote sexual violence. We get communities where all of these conditions get concentrated in a way. And what happens when we have community conditions that are concentrated in that way? Well, the people within those communities end up being exposed to those risk factors in a concentrated way, in an elevated way. So they're more likely to be witnesses to violence or to experience violence, to be targeted for and exposed to those harmful norms and practices, which is then what leads to greater likelihood of sexual violence and other forms of violence and inequities in injury, trauma, and even death. So that is the pathway to violence. It is a very quick and shorthand way of explaining what we see in the world. And now I'm going to switch gears and talk about the pathway to safety, because we know that at any given moment, also from the founding of this country, there has been resistance and resilience and efforts to create equity, efforts to dismantle those legacies of structural racism and other forms of sexism and oppression from the country's founding to today, and efforts to build equity and justice. So there is this pathway of equity and justice that creates safety and healing. And those efforts and movements have worked tirelessly to build just institutions and systems. We may not see that in all of our communities today, but we are building those. People have been building those for generations, and thank you to their efforts and to their lives to build equitable investment by financial institutions, to demand that, to hold government accountable, to address issues that we see today, like gentrification and displacement that follows investment too often, and to protect people from that. Laws and norms to protect and create equitable economic, reproductive, and other rights and opportunities. Just, praise and gratitude to all the work that's happening to create just institutions and systems that then create protective and healing communities that have equitable opportunity, residential stability, trust between government and community, equity in workplaces, and community norms and cultures that support consent and sexuality and safe and equitable relationships, and all the conditions that we know are necessary in communities to create safety and healing and freedom from sexual violence. When we create communities that have these protective factors and have these conditions, then the people in those communities have the opportunity to experience economic security, to be included in the community, to be to have their needs acknowledged and addressed, to be exposed to healthy norms and skills and things like power sharing and healthy equitable relationships. And when our community members have equitable access to that and build those skills, we have increased safety and healing and decreased racial and gender inequities and sexual violence and other forms of violence, injury, trauma, and death. So that is the pathway to safety. And once again, it's a lot packed into, words. So I'm not gonna ask Mo and Ashley to go into the chat unless you want to, in which case please do. But I'm just taking a moment to remember back to that initial chat that we had around the inequities that exist, that should say sexual violence, sorry, and why those inequities exist. So many of the things that you all talked about, hopefully you can see are represented in those pathways as well. So here's a gigantic diagram, which most of you are probably not going to be able to see, but I'm going to talk a little bit about it and then kind of break down little pieces. But at the top, you see the pathway represented. Below that are a portfolio of different types of strategies, interventions, strategies, programs, policy changes that can create change at these different points within the pathway to safety. And below that are some of the sectors and partners that we might need to partner with or to put pressure on to enact those policy changes or to implement those strategies. So wow, let's put together all in this gigantic diagram because it's complex. And even this doesn't do justice to it, right? I completely acknowledge that. But I'm going to just highlight a few strategies along the pathway. So at the social and racial equity level, there are things like voter rights, voter enfranchisement, registering people to vote, get out the vote efforts, policies to decriminalize substance misuse, mental illness, and poverty, which we know are really criminalized in so many ways. Efforts to ensure people have access to living wages and universal income. Those are some of the things that can create kind of fundamental structural equity. And at the level of institutions and systems, that's looking at ensuring equitable community investment, fair lending by banks and other institutions, doing training across sectors and systems on racial and gender justice to identify and uproot and transform the biases and inequities that are built into those systems, supporting resident engagement and neighborhood action planning on issues from sexual violence to community violence and so on, policies to reduce over-reliance on the criminal legal system, to decarcerate, to create alternatives, gun restrictions, and so on. And at the community level, this might be education-based strategies that involve looking at parks and green spaces and who has access to them, vacant lots, housing, anti-displacement, built environment design strategies. There's lots of great examples of these kinds of strategies that can be done with the intention of looking at and preventing sexual violence. And at the individual and relational protective factor levels, some of these strategies are very specific to community violence, like street outreach and violence interruption, although more and more of these types of organizations are also interrupting and intervening in domestic violence and sexual violence and learning ways to do that. But other strategies as well, like positive youth development, early childhood education, and family supports that we know can address multiple forms of violence, from sexual violence to intimate partner violence, community violence, and other forms of violence. And then, of course, at the safety and healing level, interventions that are hospital-based or restraining orders, also culturally rooted healing practices, restorative justice, trauma services, and community-led reentry support. So that kind of gives you, going back to the gigantic diagram, the notion that we need a portfolio of strategies. And we may be working on one particular strategy, but we can look at connections to other kinds of strategies and ways to support them. Or maybe we're working in a coalition that's implementing a number of these strategies. Obviously, no one individual or organization or coalition is going to implement all of these strategies, but it really gives you the sense of a movement of multiple organizations and movements and sectors doing their part to address this big, complex system on the pathway to equity and justice and safety from sexual violence. So I would love to invite chat at this time again. And the question is, I put here, what strategies do you think are missing or could be added from a sexual violence prevention strategy? I also invite you to share if there are particular strategies that resonated for you and that you were glad to see, maybe something that you're working on or hope to work on someday, or something that just stood out for you. So thinking about those portfolio of strategies, what resonated for you? What are you working on? What was missing? So I'm going to go ahead and invite you to chat that. And while you're doing that, I can also invite you to, and I'm also going to stretch Yeah, we've been going for an hour now, and that's a good opportunity to kind of check in with your body, check in with your breath, check in like, oh, am I comfortable? Am I leaning in a strange way? Is blood flowing? Is oxygen flowing? So please go ahead and stretch. And yeah, going to give a few more moments to reflect on what resonated or didn't resonate in the portfolio of strategies along the pathway to equity, justice, and safety. So go ahead. I'll be quiet now to give you more opportunity to do that. Okay, please keep them coming. I'm going to go ahead and share a little bit of what's coming up. Missing is storytelling. Ooh, I love that. So important across the entire portfolio. I agree. It can fit under a lot of these strategies. Something, yeah, I really enjoy doing. And if I was with you, I would be wanting to do much more of it. Another comment, the social emotional learning piece strategy stood out. Going to be thinking more deeply about how to integrate that into your work. Wonderful. Positive youth development, working with other organizations, not being the only one, and giving resources to survivors of sexual violences as well. So thank you for lifting that up. And that's also something that can be across the portfolio, that community leadership, that survivor leadership, and survivor voice that we talked about earlier, that's so important across these portfolio strategies. Educating law enforcement, emergency healthcare system, especially in rural areas, teaching trauma-informed care. Thank you. Yes. Thank you for lifting those up. Older people, yes, thank you. Really looking across the generations. So yes, some strategies that are specific to elders would be really important additions. Thank you so much. Parents of younger children, preteen, absolutely. There is a person who responded in Spanish. I don't know if it's possible for our Spanish interpreter to come on and let us know what's said there. My apologies for my inability to read or understand what Irma is sharing, but please, if it's possible
to speak, yes.
What they are saying, that would be awesome.
Irma Alvarado says, speak and continue fighting.
A lot of people, more organizations operate with shared management structure, so we all have an equal voice. Thank you. I'm not sure what UBI is, so Jennifer, if you'd like to say more about that, please do that. Place-based micro communities, really interesting. People, prevention work feels so impossible for people. Many folks are very disconnected from community. I would love to hear more about what place-based micro community strategies are. And there's another Spanish response. Thank you so much. A focus on healing. Yes, absolutely. Disability voice. Thank you. Community leadership, civic engagement. Enrica's saying that they're lifting that up in their violence prevention efforts. Awesome to hear. Wow. Okay. Lots of messages coming in. Okay. I'm seeing more about UBI. Oh, universal basic income. Thank you, Jennifer, for clarifying that. Okay. Lots coming up here. Jen and Mo, if you want to chime in at all, please do so. And if not, that's okay too. But Anything you want to kind of add at this?
Yeah, but I think, so Martha was talking about, we always need to be educating and support for mental health. And Irma, I believe, oh gosh, I lost the chat now, but we need to keep this communication. We need to keep talking about these issues.
Wonderful. Yes. Okay.
Lisa, I saw, oh, sorry.
Yes, please.
Oh, well, I just wanted to uplift a couple of things that I saw in the chat. One was about storytelling and the importance of storytelling. And the other one was about grief, which I think is just so present right now, and definitely needed in all of this.
Oh, thank you so much. Yes. I mean, this presentation and doing it, kind of mostly by myself, and through Zoom, it's harder to bring in the story element, the heart element, the emotion, which I am all about. So thank you for lifting that up. I completely agree. This work does require grieving. It does require sharing our stories. It does require healing and that deep individual transformation that we're all trying to do as advocates and leaders, and the relational work that we're trying to do within our movement to make it stronger. And so thank you for lifting those up. So thank you. I'm going to continue on. We have just about 20 minutes left, and I promised we were going to get to choice points. So I'm going to go through the next section fairly quickly. It's another way of thinking about some of these issues on the pathway to equity and justice. And but I'm going to go through it very quickly. I have found it to be helpful, but this comes from our Building Bridges work, where we talk about procedural, distributional, structural equity. Oh, it sounds like such big words, but basically procedural equity is really about the processes. Are the processes themselves transparent, fair, inclusive? And are the barriers to participation addressed to ensure equitable opportunity for participation? And a lot of what I've heard today really fits into that category. So I'm not going to share the example, but I find that just being able to lift up in different conversations, are we looking at procedural equity? Are we really fully addressing that can be helpful to challenges some of the ways that our work and work in the world is structured so that some people are not able to participate equitably, and processes are not transparent and fair. So procedural equity is super important. Another form of equity is structural equity. This refers to the decision-making structures, the policies that determine those structures, who gets to decide, who's represented, who's not at the structural level, the bodies that are making those decisions, that are set out to make decisions. Is there equity? And do those structures and policies, are they building in greater equity and challenging injustices? And I was going to highlight and give a shout out to the Michigan Coalition's work. It's in the paper, the Health Equity Approach paper, but this is an example of doing that work of looking at structures within one's own organization. And the third form of equity, distributional equity, this is a little bit of like bottom line. Are resources being distributed equitably across communities? Well, we know the answer to that. They are not. So what is being done to change that in a very bottom line, dollars and cents access kind of way? And what are we doing to prioritize resources for communities that are experiencing the greatest inequities? It requires pretty dramatic decisions, changes in decisions about how resources are going to be distributed. And again, I'm not going to be able to go into too much depth, but there's an example in the Health Equity Approaches paper where Oregon Coalition, shout out to you all. Sorry, I'm not doing justice to your work at all, but please read the paper. It talks about the grant program where they're trying to make resources accessible to marginalized communities. Okay. If you have questions or comments about any of that content on procedural, structural, or distributional equity, please put them in the chat, and I will come back to your questions in a minute. And gonna encourage more stretching and maybe a little bit of wiggling and movement to help us keep going on our last stretch of this conversation. So I promised you we were going to talk about choice points, and I'm super excited to do this. So what are choice points? I've alluded to this. I've mentioned this a little bit. Choice points, according to Race Forward, thank you so much, are decision-making opportunities that influence outcomes. And what's really cool about choice points is that the cumulative impact of many small choices can be as significant as the impact of big decisions. Basically, it's saying we want to change so many things. How do we break that down and sequence the steps to get there and bring it immediately to this moment right in front of me right now? I find it to be a very powerful, empowered way of thinking about change, because it really says moment to moment, we have choice points. I have choices in which words I decide to convey in this presentation. You have choices about which words you decide to convey in this conversation. I have choices about how I react to what you share, right? These are all decisions that we make that influence the outcome of this gathering that we are in today, and the cumulative impact of that, right? Of if you think about a day, a week, a month, they add up into significant decisions. So we can be conscious of this and incorporate this type of thinking, and that helps us to be less likely to replicate the status quo. It requires a lot of mindfulness and intentionality and being open moment to moment to new possibilities and leaning into and pivoting into those possibilities. So it's a deep practice, even though it might seem sort of straightforward in concept. Another concept I want to share with you is the notion of weightlifting. And this comes from the amazing Rinku Sen, who used to be the executive director at Race Forward. Rinku's moved on to another organization now. I'm forgetting the name, but Rinku's amazing. And Rinku did some deep training with Prevention Institute, which has really been helpful to us on integrating racial and gender justice into our work. So the concept here is that we need to know our current capacity in the amount of, using this weightlifting metaphor, am I ready to do deadlifting or to bench press 130 pounds, which my niece told me last night, she's bench pressing 130 pounds, which I think is pretty amazing. Or do I want to start with my 3-pound free weights to build up some initial muscle strength in making choice points around intersectional equity and justice? So the invitation is to assess your current capacity, your team's current capacity, and to pick the weight that you are able to lift without doing serious injury to yourself or to anyone else. So Rinku suggested think about 3-pound lifts. You might say, no, I'm ready for a 20-pound lift or a 30-pound lift. The point is to think about what's doable and that you can build on, and the repetition, right? The not like, oh, I did that lift, okay, I'm done. But the repetition the daily engagement moment to moment in this work. So when we make 3-pound weight choices and 3-pound weight lifts over time, individually and collectively, our capacity to engage in lifting, heavier lifts is going to grow over time with that consistent practice. Okay, so what are the steps in choice points? And I'm actually going to share, if I can do this, a Google form that I'm going to put in the chat, which invites you to reflect on a few questions, and you can navigate over there if you want to and are able. There's some reflection questions related to procedural, distributional, and structural equity that we skipped, but right below that are questions related to choice points. So as I talk through this, I'll pause, and I might even play some music, but maybe we can do questions number 1 and 2, and then we'll move to questions 3 and 4, and I'll pause with some music to give you some time to type into the Google form your reactions. And if you want to keep putting things into the chat, that's fine too, but this is a way to crowdsource ideas, and we will, figure out a way to share them back with you as well. So step number 1 is to identify a choice point. So I said every moment is a choice point, which I really think it is true. But you can think about choice points at a little bit broader level in terms of your work and where you have some influence on a decision. Kind of what's your current domain of decision making? Is it an element of a program that your organization is implementing? Is it an event that your organization is hosting? Is it an entire number of multiple programs that you are helping to fund? Is it you're the executive director and you really have a lot of influence on decisions within your organization? Is it you sit on a board or another body that has some influence over a decision or a course of action that can affect racial, gender, and other intersectional justice outcomes? So so that's step number 1. And then step number 2 is to think about in that choice point and all the examples and concepts we've covered today, and to think about some actions that you could take that could make to steer things in a more just and equitable direction. Whether it's about truth, healing, and transformation, whether it's about community leadership and power, or data and evidence-driven or collaborative action, or procedural, structural, or distributional equity, or some other concept that you want to bring into how you're thinking about making just and equitable decisions. So let's take a moment to identify a choice point and generate some options. And I'm going to pause, and just play about a minute of music to allow you to do that in silence. Hopefully you'll be able to hear this. right. That was a minute. I know it's not doing justice to the time that it really takes to answer these questions, but hopefully give you some time to reflect on choice points and options within those choice points for you. The next step is to make a determination of the course of action that you're going to take and to think about what lift you have the capacity to do individually and with your teams. So which new course of action are you going to really be intentional to lean into and pivot to and to make a commitment to actualizing? So you can brainstorm a range of options. You can take those options to your teams, get feedback from people that you trust, and select a new course of action. And then the fourth step is supports and accountability. And this is super important. We live in a context where there are powerful forces that are reinforcing the status quo, that are putting up barriers to change, that are making you, making it more likely that we will slip into status quo ways of doing things. So we have to be really intentional to create reminder, supports, and accountability practice and structure them into our days and routines to keep our courses of action, our decisions, our commitments top of priority, and to create a counterforce against or around some of those status quo forces. I recently reached out to a couple colleagues to be accountability buddies for me, where we could have relationships where I could be really honest about things that I was struggling with and report on a weekly basis the efforts that I made, and to, be heard with a lot of compassion as well as clear reflection and encouragement to be accountable. So that's been really helpful for me. It makes a tremendous difference in keeping these changes that I want to create within myself and within my choice points top of mind, day to day, week to week. So it's really important to think about supports and accountability there. And I'm just going to play the music for one more minute and invite you to go to the Google document or the chat and to type in some reflections about new courses of actions and supports and accountability. And if the Google form doesn't work for you, no worries. Just take out a pencil and a piece of paper or type some thoughts onto your computer or whatever you want to do. All right, that was just about another minute, maybe a little bit shy of that. And yeah, I saw the comment. Yeah, it's really not enough time to answer these questions thoughtfully, but I did want to give a little bit of space for me to stop talking and for you to, have some space to think and write and type and do whatever you need to do to kind of process everything. So I would be delighted if you had the opportunity to go back into the Google form or to continue to reflect on these questions related to choice points. The last idea I want to share is the notion of continuous improvement. I think this is probably a concept that many of you are familiar with, but it's, just want to elevate it here as being very relevant to this conversation about choice points. You identify the changes that you want to make. You make a plan, you build an accountability, you do it, you reflect on progress, challenges, and you identify a new opportunity. And I never thought I would say this, but life can be one continuous improvement process. Although probably what's missing in here is like pause and celebrate, or share stories and laugh, or like stretch. Obviously, there's a lot missing in this cycle, but hopefully you get the point that these are some of the steps that are helpful for taking these transformations that we are seeking within ourselves, within our organizations, within our communities, within our society and world as a whole, and bringing them to our own actions and our collective actions that can truly transform, heal, and generate greater equity and justice today and into the future. So here are a couple slides just sharing a couple additional resources. We did a web conference with Prevent Connect on truth, healing, and transformation. Here's the document that I've been referencing with NSBRC. Here's another resource, and all the resources that you all shared. Okay, last chat question, and I'm going to play music for a minute while you chat. Please share a gem or a pearl that you are taking away from our time together, something that came up for you, something that you read in the chat, something that I shared, anything, something that, I don't know, anything, please. What's up for you right now that feels like something that you are taking away from our time together? So I will go ahead and play a little bit of music while we reflect on this. It's 1 o'clock and we've spent an hour and a half together, and I'm so grateful. This has been such an honor and privilege and highlight for me. Thank you, thank you, thank you. I wish we could be in person. I hope we can connect. Please reach out to me, Lisa at Prevention Institute. And just gonna put some outro music on. Please, leave at your leisure. I know we have places to go. So just so much gratitude. Please take good care, and I look forward to the next opportunity to connect. I'm going to leave you with Plant the Seed by Taina Asili. She is singing about, oh my gosh, I'm having a brain fart. Okay, I'm just going to play the song. I'll put in the chat what she's singing about.
This is my declaration to be fully alive, healing. This is my reclamation of my ancestral wisdom. The earth, it's saved it for me, and I plant the seed.
Thank you so much, Lisa. That was such a fantastic workshop, and just so much gratitude to you and to everyone who joined this session. We hope you continue to join sessions throughout the rest of the week. And again, just thank you so much. And I agree, that's a great song. Thank you for sharing everything with us, Lisa. Thank you all. Take care. This will conclude this workshop session. We'll see you tomorrow.